Hi, my name's Joe Wright, and I'm Chief Financial Officer at Glenwood Medical Associates.
I'm Karen Gentry, the Nurse Manager at Glenwood Medical Associates.
I'm Timothy Burns. I'm Glenwood Medical Associates Chief Administrative Officer.
I wanted to talk to you a little bit today about Glenwood Medical's participation in the Beacon program and the successes we've seen as a result of being a part of that.
Part of the process of learning how to efficiently develop a quality improvement model was to bring all of our staff together and really celebrate the process and focusing on the success stories.
When Tim Burns, our Chief Administrative Officer, suggested to us last year that we enroll in the Beacon program, I think many of us thought he was crazy. And looking back over the last 12 months, you can see the progress that we've made.
From a nursing perspective, we've noticed gigantic improvements. It has been a lot of work in some respects, but we are seeing multiple gains from it.
The project was highly successful, very challenging at first, but part of those challenges were first met by our focus group and the committee that came together to work with the Beacon. We were successful in putting together this storyboard presentation that represents MASH. That was the theme that we followed.
We are a multi-specialty practice, and it's been a wonderful collaboration of all departments with tremendous results.
Every day at Glenwood Medical Associates, we act like a MASH unit, putting together the various requirements of making it all happen for patient care. And we thought the MASH theme was very appropriate given our day-to-day and how we take sometimes a very chaotic day and make it work smooth.
I would think the greatest achievement we've made is a smooth transition in converting to a new electronic medical record, which has allowed us to become successful in achieving meaningful use standards.
One thing that was probably the most difficult part of the model that was challenging for our practice was learning this expanded care model and how to work with populations, population health outcomes, and dealing with functional and clinical outcomes.
The data that we've been able to produce has shown huge improvements in our patient care, in our quality of care, and is helping us move quickly towards our ultimate goal of becoming a patient-centered medical home in our community.
When the Beacon approached us, they sought us out to come on board. It was at a time when we were actually bringing on the new electronic health record and practice management system.
Not only do we have the challenges of getting data into the new EHR correctly, we also have the challenges of being able to extract that data in a meaningful way.
And we felt that we didn't have the resources to take on another large project, so we backed off and said, this is horrible timing, but we were told immediately by the Beacon that no, this is perfect timing to enter into this project. So after doing some reference checks, we jumped on board. And like I said, our staff really wrapped their arms around it and were excited about the opportunity.
Tim has a persuasive way about him and was able to convince not just the providers but the rest of the staff that this was the way to go. And his vision is proven true not just with this most recent program, but also with his foresight more than 15 years ago when he was ahead of the curve and convinced the providers at that time that we should switch from paper charts to electronic health records.
The most pleasing part in all of this to me as the nursing supervisor is that it has brought my department closer together. There's been a lot of cooperation, a lot of interest in improving our practice style.
Of course, I want to thank the staff, particularly those staff that have worked on the focus group and the practice transformation group. They were terrific. But more importantly, out to the physicians, the other clinical staff, nursing staff, medical assistants, and then the support staff, and patient financial services, reception services.
I'm grateful for their participation and ongoing support. It's really been a collaborative effort, as I said earlier, with all of the departments.
I just want to thank everyone who's been involved with this project. Tim Burns, our Chief Administrative Officer, who got the ball rolling for us, and his leadership along the way, keeping us all motivated to reach our goals. To Dr. Paul Salmon, our medical director, and all the providers here on our staff. To all the clinical staff who worked so hard to help the providers, prod the providers, and get the critical data into the system that we needed in order to measure our performance against these benchmarks. And to the administrative staff who's helped support us along the way.
We've all come together in this tremendous process of practice transformation, and it's not been easy, but in the end, it's going to work very well for us as we move more towards a patient-centered medical home and also leverage those capabilities with the CPCI requirements. It's been a tremendous process.
So thank you to everybody that was a part of this project.
So thanks to everyone, and thanks to Beacon for choosing us to participate in this program.